Thank you so much. I'm a kind of dumbstruck because I think the eminent galaxies that are around me today in the program has kind of left me absolutely dumbstruck. Like right from DDT sir, AGT sir, all of whom we have kind of idolized. And I can't start without mentioning Dr. Warrior sir. For me, he's like a Dronacharya, and I'm the Eklavya because he and me go a long way similar. My talk would be lot of similar to his hand instruments because I am also a small joint surgeon like him. But I think the corollary is right that my level is really low in front of him. Like I'm at the foot end and he's at the hand end. So with his permission and blessings, I would like to start. Uh, the inventory in foot and ankle, reduction tools, and low profile plates. So in inventory, I think for foot and ankle, especially where we do a lot of deformity correction, I use the laminar spreaders extensively to expose my joints. And it's very important that the tip of these laminar spreaders, as have been circled, have to be narrow and low profile so that they can get into those smaller joints and expose or distract those joints where you can like quite generously expose and remove the cartilage. So please look at the tips, and it's very important that you buy those fine tips where you can go in. Similarly, second instrument which is very common and very extensively used in foot and ankle is Hintermann's retractor. These are retractors which have holes at the tips where you can pass in wires. There are 2 points, that is like 1.5 and a 2.5 slots where you can put in the wires and again distract the joint or open the joint very easily from here. So what does this do is, if you're using a laminar spreader, then it goes into the joint and that much area of the joint is kind of being covered or not allowed to see, and you will be able to work only on the front. On the contrary, if you're using a Hintermann's retractor and you're distracting the joint, then you will be able to see the entire joint quite beautifully. So that's the importance of Hintermann retractor over a laminar spreader. But again, it depends on the K wires and the hold of the K wires on which you can expose it. Similarly, bone nibblers, which again, as Dr. Warrior said, it's important to have sharp, low profile, pointed bone nibblers like these ones. So you should have one small and one medium size. You'd hardly need more than that in foot and ankle, but it's important to have them sharp and low profile and kind of bird beak kind of nibblers like this. Next is osteotomes. As Dr. Warrior sir said, that you need all kinds of osteotomes, right? From flexible, curved, Lambert's osteotome, which are like these, or sometimes MIS instruments, which can be used as osteotomes, which we use in foot and ankle for deformity corrections and fracture fixations, where you can go in the fracture line of calcaneum, which is like a bag of bones, and elevate it to kind of distract and reduce the bone. So osteotomes, sharp osteotomes, are extremely important. Upkeep of them has been described by Dr. Warrior and other surgeons before. Next is a good curette. Again, this curette, as Dr. Warrior said, has to be small, has to have a wide, firm grip, ergonomically designed, where you can hold it and use it. The lever arm of the curette has to be small because as an extremity surgeon, you need to work in smaller areas and you can't have those big curettes which you are used to in other big bones. Similarly, the KYs, you should have all sizes, right from 2.5, 2 mm, 1.8, 1.5, and 1.2, and sometimes up to 1 mm. I hardly use 0.6 and 0.8, like not much used in foot and ankle as much as in hand, but you need to have all of them on your table and use them appropriately in certain situations. So general instruments, as Dr. Warrior said, Adson's forceps, like plain and tooth, not opening more than 10 to 12 mm, which are ergonomic on your fingers. Small Bowman's bone livers, again, you should have them low profile. I use this McDonald's retractor quite extensively when I'm doing my dissections. Small cat's paws, like all sizes, mastoids or self-retaining retractors, and a sharp Steely's scissors. Very important, like Dr. Warrior said, in foot and ankle also, we kind of echo similar sentiments on general instruments. So tip, be careful as an extremity surgeon whom your systems are used or opened to other surgeons. This was an excellent bone nibbler which was bought by me but used by my shoulder surgeon, and he has kind of made it condemn. Now we have a talk on how to use this condemn instruments, or as Dr. Warrior said, now I use this to kind of pull out wires from my extremities, which I have kind of put it. But be careful so that your such important and fine instruments are not destroyed by uh, your own colleagues, or sometimes OT staff in a kind of a panic where some senior surgeon orders something or something, open up your instruments and give it to them, but you have to warn them not to do that in your cases. So in reduction tools, I think the most important reduction tool, or the most important reduction tool in my armamentarium, is a good towel clip. I have various sizes of them. Most of them I would use while reduction would be blunt tip, something like this, which kind of is not as sharp, and you can hold all kinds of bones, especially in your extremity, to hold and reduce it. So it can be used for lateral malleolus, it can be used for medial malleolus, it can be used extremely well for reduction of Lisfranc's joint, which is shown over here, and it can be fixed with a screw or a tightrope new mechanism, which is over here, or metatarsals. So reduction tools, I think for me in my hand, most important is judicious use or appropriate use of a good towel clip, which is kind of much less or rather low profile than a bone holding clamp. So coming to low profile plates, I think they are in vogue. And if one thing that has changed extremity surgery is going to be low profile, dynamic, sturdy plates, which have kind of revolutionized fixation modalities in foot and ankle. So what has changed is Synthes has come out, or without naming any companies, they have at variable angles, you can change the angle and still lock it. So certain companies like Synthes have a 30 degrees variable cone, which can be kind of applied at certain things, while other companies have around 10 to 25 degrees, whichever ones you want to adapt to. So what advantage does these variable angle plates give is like angular stability, which gives better purchase of bones of bad quality, especially the small bones. It supports of reconstructed articular surfaces, like no primary or secondary loss of reduction. And because it's a locking plate, there is very less chance of screw backouts. Low profile or highly polished surface prevents tendon irritation or tendon adhesions. And it can be used on both surfaces, like plantar as well as dorsal surface, especially if you're doing a tarsometatarsal joint fixation. The biomechanical studies show that the plantar plates put on the underside gives better stability, and you have plates available now which can be put as well as dorsal as well as plantar surfaces. And because it is pre-contoured and variety of lengths are available, there is less OT time used to kind of put these plates in place. So with this, I'd like to end. Thank you very much, Dr. Chandak, for giving me a place in this galaxy. Thank you.